Hi, Zepbound catch-up time. I've now been on Zepbound for 16 months. Still love it, zero regrets, still getting good results, and so I'm still a fan. I want to suggest that if you're somebody that's contemplating going on Zepbound and you have a few questions, or if you're somebody who has a partner or loved one that is negative on Zepbound, I would encourage you to listen to the Oprah podcast from January 14th and January 21st. They have a really great conversation with an endocrinologist, Dr. Anya, and she lays out things in an easy to understand manner and how obesity is a disease and how we treat diseases. It's really interesting how she compares it to, we give people high blood pressure medicine. We say, eat low processed foods, drink plenty of water, get your exercise, and here's your medicine. And we're doing the same thing with Zepbound. Doctors are still saying, eat low processed foods, plenty of fruits and vegetables, get your exercise, and here's this medication. But it's just looked at it so different because the results are very external and where you can't tell if somebody's blood pressure is going up or down. So I thought it was interesting how she related it that way. She also encouraged us to think of it as a obesity medication, not a weight loss medication. It's not treating you for weight loss. It's trying to treat your disease of obesity. And I thought that was a really great way to look at it. I know that there's still a lot of people that say it's the easy way out. I just don't believe it. There's nothing easy about trying to lose weight, no matter how you do it. Did this give me the absolute tool I needed? Yes. I didn't know I needed it, and I feel really bad when I think back to the pain I put myself through mentally because I couldn't do it. Couldn't stick to the plan, didn't know what plan to stick to. So is it easier than I've been through before? Yeah, thank goodness. Or I would still be on the same yo-yo, up and down, up and down, up and down with a crazy mind. Since I've been on here last, I did have my 1-year checkup and my blood pressure medicines. I used to be on 3, which I guess that's kind of normal for blood pressure medicines. I always thought that was a lot, but 1 water pill and then 2 meds. And I'm rid of 1 med completely, and the other 2, I'm down to half of what I had been on. One of them, I actually have to bend the pill in half because they don't make a dose small enough, but we're still watching my blood pressure because it's pretty low. But if I go without them, if I, take a trial run without them, it starts to creep back up. So for now, I'm going to stay on those. I'm also on half the dose or a quarter of the dose of the happy meds I was on. I didn't realize a lot of my mental depression, anxiety was caused by trying to figure out what to eat, why I couldn't get control of what I was eating. So I've been able to lower those too. So it's fun just to have a couple meds a day now. Let's see. In the last 16 months, I hit another weight loss goal. And then I also hit a separate goal after that. I needed to get a new picture for my license. And I had kind of set it up for if I, hit a certain weight goal that I would do that. So I did get my picture redone, and I cannot believe the difference. Some people are like, is that even you in the before picture? But it was me. Anyway, so that felt good. So overall, I'm down 86 pounds. And I don't know what my average is. I was trying to look at that, but it looks like it was just giving me an average for the past 30 days. So I think it must be, I don't know, 52 weeks in a year. I think I'm just right at under a pound a week. Some weeks it's nothing. Last week it was 3 pounds down. So mostly it is a half a pound, 1 pound. Mostly it's in that range when I weigh once a week for that marker. The other thing I wanted to talk about was that I did switch pharmacies. So I was getting my med at a discounted rate of $550 at Costco. Now, Lilly Direct is the pharmacy related to Eli Lilly, the company that produces Zepbound, and they have a direct pharmacy. And so my doctor now sends my script there. The one big change is that instead of an auto injector pen where you just push it, is you do have to draw up your own meds and be comfortable with administering it that way. So I had a quick tutorial and I've done my second shot on my own, and it actually is just not painful at all. It's in fact a little less painful than the auto injector. So no regrets. You have to buy some syringes with that, but it all comes together. You order it from also Lilly Direct. And so I'm saving about $45 a month, which, that adds up, especially considering that this is a lifelong med. Back to the Oprah podcasts, Dr. Anya was talking about how doctors just aren't trained very much in weight loss and nutrition, and that's why she kind of specialized in that. But, she gets frustrated when there are, of course, people, as we know, that have side effects on Zepbound, and they want to switch the med right away or take them off the med. And she wants people to give it a chance to treat the symptoms of the side effects, not stop the med. And oftentimes, take an anti-nausea, try another vitamin. She was giving different suggestions. I don't remember them because I don't really suffer from very many side effects. But she just said, doctors need to realize this is a lifelong med. And she also says when she has her patients get to maintenance, which I hope I'm close to maintenance in the next, half a year, that she likes to drop you down in dose very slowly. So if you're maxed out on the dose 15, she doesn't want to put you back at, 7.5 milligrams every 2 weeks. She might back you down to 12.5 milligrams every 10 days and see how you do. She doesn't want you to get so far away from the med that the food nice comes back with a vengeance. She said that messes with you mentally, and it's just, harder to recover from. So she also said she checks back in with her patients pretty quick after they make a decrease in medicine to get on maintenance, because she wants to stay in control of things as far as food noise goes. So, and again, I can still tell when my med is nearing its half-life. I think about food more. Things that didn't sound good 3 days into my shot are like, having a Coke, that sounds pretty good. So I can see that makes me a little nervous about when I get to maintenance, like how far will I be able to spread it out? A financial savings would be awesome, but I'm kind of resigned to the fact that this is just going to be, it's kind of like a car payment. It's my med payment. So I'm at this point, I'm still willing to do it and thankful that we can afford it right now. So, but I am happy that we're saving $45 for sure. I don't know if there was anything else I was going to talk to you about. I don't think so. If you have any questions, let me know. I'm happy to talk about it. That's all I know. I'm so thankful it's available. Have a good week.